Okay, so cancer of the brain. Cancer of the brain, right? Since you started, we've been talking about cancer, right, of other organs. So it's not different from cancer of the brain, right? So cancer is an abnormal proliferation. So anywhere you meet it, it's an abnormal growth of the cells, but the organs, now we are talking about cancer of the brain. So it's abnormal proliferation of the brain cells, right? Abnormal proliferation or abnormal growth of the cells of the brain, right? It is also defined as an abnormal growth of the brain tissues occupying space in the skull, right? Okay, so when you have the cells of the brain growing abnormally, we term it as tumors of the brain or cancer of the brain, right? There are types of brain cancer. We have the infratentorial type, and then the supratentorial, infratentorial, and then the supratentorial, right? So as the name implies, infra means below, while supra means above, right? So the infratentorial occurs below the tentorium of the cerebellum, right? So I ask you to read on the anatomy and physiology of the central nervous system, right? So if the cancer occurs above the cerebellum, right, it's termed as the supratentorial brain tumor, and if it occurs below it, it's termed as the infratentorial brain tumor, right? Other types include durameningiomas, right? That is a type of cancer that occurs around the covering of the brain. We know that the covering of the brain is known as meninges, right? So if you have cancer of the meninges, especially with the dura, because the covering, we have three parts, right? We have the dura, right, the arachnoid, and the pia mater, right? So if the cancer is affecting the dura part, we term it as dura meningioma, right? And then we have acoustic neuroma. It's another type of brain cancer. Acoustic neuroma, right? It's cancer of the cranial nerves, right? Cancer of the cranial nerves, right? If we are talking about the central nervous system, right? We have the central nervous system and the peripheral nervous system, right? So with the peripheral nervous system, we have the spinal nerves and the cranial nerves. So try and review the anatomy and physiology so that you don't get confused. So if you have cancer of the cranial nerves, right, we have 12 cranial nerves. We term it as acoustic neuromas. And then glioma is cancer of the brain tissue itself. Glioma is cancer of the brain tissue itself. What are the risk factors for brain cancer? Genetics. So family history is one of the risk factors. And then exposure to radiation, right, can also increase your risk. Some infections like viruses, exposure to viruses, right? Some of the viruses include Plasma gondii, varicella virus, influenza, etc. Right? And then people who smoke also have increased chance of getting brain cancer, or they have increased risks to brain cancer. And then people who take in alcohol are also at higher risks of getting cancer of the brain. And then it's more common among males as compared to females. It's more common. This is from some publications or published articles, right? So it's more common among males than female. The common site of metastasis, right? If cancer of the brain, if it spread, the other organs that it can spread to includes the breast, right? So people with brain cancer can have metastasis to the breast, to the GIT, to the kidneys, to the lungs, and then to the pancreas. To the breast, GIT organs, kidney, lungs, and then pancreas, right? Signs and symptoms of brain cancer, right? If you have brain cancer, what are some of the signs and symptoms that most of the time I've told you that the signs and symptoms, you have to look at the organ involved, right? So if it's the GIT, even if you don't know any of the signs or symptoms, once you know that it's a GIT, you know that at least nausea and vomiting can be there, right? So with the brain, the signs and symptoms, you have headache, right? So headache is one of them. The signs and symptoms of brain cancer. And then because you know that with the CNS conditions, the intracranial pressure most of the time increases. You can list all the signs and symptoms of the increased intracranial pressure that we talked about earlier, right? So headache, restlessness, confusion, anxiety. We talk about visual disorders like blurred vision. We talk about diplopia, double vision. So it's also here, right? And then it can also lead to seizure, right? Seizure. And then the patient can go into coma, or there can be decreased level of consciousness, right? There can be decreased level of consciousness, or the patient can go into coma, right? And then it can also affect their speech. People with brain tumor can also have difficulty in speaking. So there can be aphasia, right? Loss of voice or absence of speech. And then there can also be, I've talked about the decreased level of consciousness. There can be ataxia. Ataxia is the coordination, right? So they have difficulty in maintaining their gait, right, when they are walking, right? And that is what we term as ataxia. And then they also have difficulty in writing. So they have difficulty in performing motor activities, right? Like difficulty in writing, difficulty in speaking, dysarthria, difficulty in swallowing, dysphagia, right? So they have difficulty with all these things. And then there's what we call, there can be vertigo, there can be hemiparesis, right? And all that, right? So there are several of the manifestations that this patient can exhibit, right? It can even lead to nausea and vomiting because of the increased intracranial pressure, right? Nausea and vomiting. And most of the time, the signs and symptoms depend on the part of the brain that is affected, right? So it depends on the part of the brain that is involved. So if it's an supratentorial brain damage, then it can lead to cranial nerve dysfunction. So there can be absence of gag reflex. There can be loss of blink response. So you are bringing something close to the eyes and the patient cannot even blink. There can be severe headache. There can be visual disorders, right, like blurred vision and all that. And then there can be loss of voluntary movement, right? So you ask patient to lift the arm, the left arm, and patient cannot lift it, right? And then there can also be cognitive disorders, right? So the patient can have loss of memory, right? Loss of memory, so amnesia, and then language difficulty, right? and then sometimes there is nausea without vomiting. Okay, so if it's affecting the infratentorial part, or is an infratentorial brain tumour, it can lead to hearing loss or ringing sensation in the ear, tinnitus, and then it can lead to facial dropping, right, and then difficulty in swallowing, dysphagia. It can also lead to nystagmus, right. So sometimes there is involuntary movement of the eye, right, and then it can lead to ataxia, hemiparesis, etc. Right. So the part, I'm saying that the signs and symptoms may also depend on the part of the brain that is involved. Diagnostic investigation is similar to the head injury, right? So you do the head CT scan, you do MRI of the brain, right? You do X-ray, ultrasonography, you do the positron emission tomography, right? So it's similar to the head injury. Sometimes you have to do the lumbar puncture and then all that. Okay, and then cerebral biopsy, right? Because it's cancer, sometimes you want to analyze the tissues to be sure that it's cancer but not any other. Nursing management. The nursing management most of the time depend on the signs and symptoms that the patient is presenting, and you know the signs and symptoms already. So let's look at pre and post-op management, right? Surgical management for somebody with brain tumor, right? So the surgical management is craniotomy. The surgical intervention is craniotomy, right? So we are going to look at what craniotomy is, the pre-op management for craniotomy, and then post-op management for craniotomy.